Good morning. My name is Desiree and I'm with the El Paso Chamber. I'm here this morning on our Facebook live chat with Art Gloria. He is the president of the El Paso Society for Human Resource Management. And we're going to ask him some questions in regards to human resources and what we can expect during this time of coronavirus. So, Art, thank you so much for joining us.
Hi, Desiree. How are you?
I'm good. Can you tell us a little bit more about your organization and what y'all do in El Paso?
Yes, most definitely. So, my name is Art Gloria, and I'm the current president of the El Paso Society for Human Resource Management here in El Paso. Um, we are currently we're the voice of everything work, and so everything obviously is affecting the workplaces right now with COVID-19, and we're part of SHRM, so the Society for Human Resources Management, and so globally we have 300,000 members of HR professionals and business executives, and globally we're in 165 countries and we affect the lives of 150 million workplaces. So SHRM's an awesome organization for HR professionals where we get all the resources and tools to help every business succeed in whatever type of like business industries that they are in. So that's what we do with our HR professionals here in El Paso.
That's so I'm sure that with the changes with coronavirus, you guys are getting a lot of questions. You know, a lot of human resource departments are having to kind of rethink their employee guidelines with everything going on.
This is correct. I mean, since it's been developing and whatnot, I think that we've all been, stuck to the news and to the announcements that the DOL has been providing us in the guidance, so we could provide and ensure that we're providing safe workplaces and that we're instituting the right measures and with the right guidelines, and that we're just following the law. And everything's so fluid right now, Desiree. I think that it's one thing today and it's one thing tomorrow. So it's very, it's changes. I mean, now with the Family First Act that was passed on that started on April 1st and it'll expire in December 31st of 2020. I mean, there's a whole new, set of rules and guidelines that as HR professionals, we have to follow if we fall within the categories of the Families First Act. And so having to learn that, and I mean, we have all these webinars and all these resources, but I mean, we're just taking it day by day because we really don't know how it's gonna pan out. And what we just do is base it off of our, best judgment of what we've done historically in cases like these. But I mean, we've never been in a global pandemic, in a pandemic. And so, I mean, this is something that, it's a war we're fighting. And so basically, and all the workforce is fighting this war together.
Okay, perfect. So I completely agree. I don't think anyone could have foreseen how over encompassing all of this would be.
Mm-hmm.
So I think right now a lot of industries are just kind of trying to feel in the dark basically and institute new regulations and rules that have come into place legislatively. But before we dig into some deeper questions, I just want to remind everybody that this is a Facebook Live session. So your questions are coming in at real time. So if you are in HR yourself, or you are an employee who has some questions regarding human resources, Art is more than happy to answer them for you. So please go ahead and comment. We'll get those in real time and he can go ahead and answer them for you. But let me go ahead and get started on the questions that we have for you, Art. So one of the questions we had are essential businesses liable if their employees start to experience symptoms due to exposure?
Well, I mean, currently the ones that are really being exposed, I mean, is the medical professionals, the first responders, service workers that are providing that are working at the grocery stores and delivering food. There's also jobs without flexibilities, like those that are working in the restaurants that are currently the drive-throughs and whatnot. Airline personnel are still out there. There's actors and dancers, that I mean, they're not working right now, obviously, because I mean, look at Las Vegas. So yes, they are um, liable if they were to be exposed because of the occupational disease. There are, it needs to be a work-related condition. And so under circumstances that they have been exposed in the workplace, then in that case, they would be liable for it. It does take the insurance, whoever the insurance carrier for the workers' compensation is, to do an investigation to see whether or not the employee contracted the virus at the workplace. So it will, I mean, my recommendation, if an employee or the employer is in a situation like this, is that they still follow the procedures. If they were to have a safety incident in the workplace, that they report it and they follow the steps. And then whatever sorts out, where it got exposed and whatnot. I mean, the most important thing is the safety of the employee and all the other employees in the workplace. So and report it to the workers' comp, to the doctor that you have, on call for any of the workplace incidents. So yes, because of
So,
the
for instance, my mom is a nurse.
Mhm.
So if she was to get coronavirus,
Mhm.
that would be something that her work would be liable for.
It would be something like they would have to investigate the circumstances. They would
Okay.
follow the procedures of of the safety procedures of
Right.
reporting and going to
So the
doctor.
companies still have to go by their guidelines.
Correct. The
Okay.
guidelines are always there. Now, where did your mom contract it? Did she get it during the grocery shopping? Did she get it exposed during the patients? Then the investigation will unravel there, who was she with in contact and whatnot.
Okay. And if it is discovered that you did contract coronavirus from your workplace,
Mhm.
would an employer be required to pay hazard pay?
So there is okay. So that's a different question. So are employers required to provide hazard pay? So currently, under the definition of the DOL, hazard pay means additional pay for performing hazardous duty or work involving physical hardship. Work duty that causes extreme physical discomfort and distress, which is not adequately alleviated by protective devices, is deemed to impose physical hardship. So if we read that, right, that guidance, we see, well, yeah, I should get hazardous pay, but because we're in the pandemic situation.
Mm-hmm.
But it wasn't the case a year ago or a couple months ago.
So this is like a whole new frontier.
Correct. So hazard pay, you're seeing some employees out there on strike that are doing delivery because they're concerned about their health.
Mm-hmm.
But in the past, their jobs weren't considered hazardous. And so that's something that wasn't, done. So should they get it? I mean, that's something that should be discussed within the organizations. I know that, there's the third stimulus package that is currently being worked on does include hazard pay for the medical and first responders, but it doesn't cover the other workers that we were talking about, the service workers, the ones that don't have that flexibility, the airline personnel, stuff like that, because they weren't categorized as such.
Okay, that makes perfect sense. Okay, so it just really, because of the changing times and all the new things that are being rolled out, we just kind of need to keep our ear to the ground and follow what's already in place.
Correct. So I mean, it's not that that we don't want to provide that type of compensation. I mean, the risk is high. I mean, they're in the front line. But because of the guidelines that are currently there by law, I mean, it's not something that, is out there yet. It's not to say that tomorrow that might be changed.
Okay. So can essential employees who are in high risk health categories take personal leave if they're not comfortable working on site?
So that's a great question. So then it's I can't give a blanket statement that, yes or no. So it's a yes or no question. It just really depends on where you fall with the Family First Act. If you're in the threshold that you are employed in an organization that has 500 plus, then you would have to go with the guidelines, that of the employee handbook that they have in place.
Okay.
And they would, you would seek for FMLA and a type of accommodation. Let's say, your mom, I don't know in what organization your mom works for, but like if she were to work like, in the private sector, like in one of those hospitals, and she has an underlying condition where described by the CDC, then she could start going through the process of requesting FMLA or like, an accommodation because she's being exposed at that level. Even though her job requires it, there's ways. But I mean, it's not a yes or no. Now there's the ones that fall under the 500 less threshold, that act follows and it excludes healthcare. But then it gives that leeway that, it could be taken on a one-by-one cases. It just really depends on like, your organization and how the organization is going to handle that situation. But I mean, like I said earlier, this is a war. And I think that, my friend described that earlier, yesterday, actually, and this is what they need to do. I mean, like, unfortunately, we all studied a profession, a passion. And so it's like, there are soldiers right now.
Right. So essentially, there are ways if you're not comfortable and you are at risk health wise
Right.
to follow, but you must follow the protocol that is set up by your work.
Exactly.
You can't just not show up and be like, oh, coronavirus. And I don't want to, yeah, no. You have to follow the protocols that are still in place.
Yes, I mean, there's examples like, like of a healthcare administrator that works in a hospital and he or she might not feel comfortable in the workplace. So at that point, they could put in their resignation. I mean,
Okay. Okay, so rules are still to be followed and people are still going to be held to that threshold. The
okay,
employers are still going to expect that you are giving them adequate notice and you are following the rules regardless of the health crisis at hand, just because you still do need to follow those protocols.
correct. I mean, the Families First Act really like, covers childcare and all those other circumstances that we're all facing. I mean, right now the schools have closed down, so there's children at home with their parents. So that's like, like another added stressor to their daily lives that wasn't a situation. So I know that let's use it. UMC, for example, is partnering up with the YWCA and providing childcare. So I can't imagine a nurse going and saying, "Well, I have like a burden, a qualifying factor, under." Number 5 under the Family First, saying that I need childcare because they've made accommodations
Mm-hmm.
for that, but then you can't really force the employee either. And so at that point, it's like in a one-by-one case.
Okay, so it would still have to be something that is directly discussed with your employer. This can't be something that is just a blanket statement issued by the federal government. This is something that you would still have to go to your head of your company with and discuss. But
Yeah.
you are high risk health and you are on the front lines. There are ways for you to remove yourself from the situation so that you ensure your health and safety first. But
Correct.
you would have to discuss it with your boss or with the owner of the company and go through the proper statements such as filing for FMLA.
Exactly. So, the ones that are above the threshold of 500 would have to file to FMLA. The ones that are under the threshold of 500, will now have the option of having the emergency FMLA that wasn't there before, or the emergency sick leave also. And so that's only for those under the threshold of 500, and they can't go underneath 50. So then when if you have 50 employees or less, then you don't have to follow those guidelines. And then at that point, it's like also on an individual case by case, that you would have to navigate that carefully.
Okay.
Mhm.
Sounds good. So still follow your protocols, and if you feel that you're at risk, make sure that you talk to your employer and see what you need to do in order to file.
Correct. And, you know, we have the information on our website at www.epsherm.org. We have the COVID-19 section, and we have a bunch of you know, resources that we've put out there for our HR colleagues and for the community to use because for business owners, I really feel like everyone's HR. I've always said that. I mean, HR impacts the lives of everyone and everything and every day. So I really, really recommend that everyone goes and makes use of the resources that, you know, we compiled of different organizations and agencies to help business owners that don't have an HR, you know, navigate through these hard times right now. Mhm.
Okay, perfect. So your organization can in fact help people who come from a business who does not have an HR director.
Correct. I mean, like, you know, we are there to help the community. I mean, we're a resource.
Perfect. So you guys really are the assistants to the first responders. So if anyone has any questions and they aren't quite sure of where to go in the workplace to talk to someone about what to do, you guys are that resource for them.
To provide like, you know, advice, and we're not legals. We're not attorneys, you know, so like, this is not lawyers. We could just, you know, give you advice, you know, on what your story is and how, like, you know, and see if it's a qualifying factor or not, you know.
Right. So you can give the guidance, but ultimately it is something that has to be dealt with the particular company at
Correct.
hand.
Correct. Because it's not like, you know, they could tell me a story and, but then they also have to follow their set of rules from
Okay.
the. Mhm.
And I know in the city of El Paso, we just started the, stay at home.
Mhm.
The city is continuously updating, and the county as well. Mayor Marco and Judge Samaniego are both very in, intent on keeping the spread of corona very minimal if they possibly can. So I know parks have been closing, and they're getting stricter with the restrictions. So as of right now, most companies are working remotely. I know for us at the chamber, we are in fact working remotely as well. Are there certain adjustments that businesses should or must make to maintain productivity? Because I know at home, I look at my dog and he looks like he really wants to go for a walk, and then you know that floor looks really dirty, and so suddenly you're kind of getting pulled in all directions.
Yes, most definitely, Desiree. So, I mean, that's all of a strategy for infection control, you know, to limit like the exposure of individuals with one another. And so it's something that remote working should have been discussed in your workplace, like, you know, way in advance, not yesterday or before the order was given. It's like, oh my gosh, the mayor said, like, everyone stay home, go home. And then everyone's picking up their stuff. No. I hope that people really took the steps, you know, prior to that. I mean, I know it's a fact that, you know, 97% of like, you know, HR professionals did do that, you know, that they took the proper steps of ensuring, you know, having a work from home policy in place. Those are available also online if the employers don't have one, and how they go about that. I know that when everything was happening, I'm usually the one that always I think of the worst case scenario because that's my job. I have to go to the worst case and work my way of making it better. And so when I was hearing about coronavirus and whatnot, it just really, I started thinking the worst. And so then I did get with my team and I told them, you know, like, guys, like, how would it look if we work remotely? I mean, I'm blessed that, you know, I could work remotely because I have everything on the cloud. So I'm basically mobile, but that's how my job was structured. Because I have to oversee like branches and whatnot. But then there's the admin that, you know, work in their desk and whatnot. And so they, I mean, are not mobile. They had to like sit in their computers, the recruiters, the branch managers are mobile also. So then I got with them and I told them, you guys need to think the worst, and let's plan how would it look if we were to work remotely. So I think it's a plan of strategy. I mean, at this point, it's kind of late if you didn't do that. But I think that it's really important to establish guidelines for working remotely and how often and in what ways employees check with their managers. That's very important. I think it's important to over communicate when you have your staff now at home, and they're working from home. Over communicate. I mean, I wake up in the mornings, and then get ready. I mean, I do get ready because I don't want to feel depressed, that I'm stuck at home.
Right.
I mean, I don't want to be in my pajamas. I know that earlier before we were doing the screens, like, are you wearing shorts? I'm like, no, I'm wearing, wearing my jeans.
I know. Like, man, yoga pants, right? Who would have thought they would have come in handy this early in 2020?
Seriously. I mean, you want to feel good about yourself, I mean, we're in this uncertainty. I mean, we don't know. We're in this together, so we don't know if we'll be here tomorrow. So it's like just live your life, like be happy that you're working and set that time. So over communicate. I mean, we do like good mornings, like on we have like an intro chat that we all do. It's important also to be, if you're going to be having meetings and whatnot, to be mindful of the time differences. If you have organizations that are big, and you have to consider those also. So you're not like, chatting people at this in the morning or after work hours. Also, it's important that you know how to manage conflict during this time, and it does come. And so I do get phone calls of how to manage situations, and you need to have a plan, even though you're at home, and how to do that from home and be able to solve the problems. I mean, you didn't stop working; you're still working.
Right.
And then schedule regular check-ins with your employees. And so I mean, you call them. I mean, luckily what we did with our equipment, and we'll talk more about that later on, but we were able to bring our phones home. So I mean, I do random phone calls. I'm like, hey, how are you guys doing? And then the chats really work. So I think that there are platforms and softwares out there for you all if you don't have. I mean, some of them are free. You don't have, like, they're not expensive. You could get Google, and like, start getting Google email accounts and do Hangouts. There is Facebook also that you can utilize, and there's different platforms there to be in contact with our employees. It's also important that you're flexible. I mean, you talked about wanting to like clean this and be that. I mean, like, and then with children at home right now because they're not at school, as an employer, you have to be flexible. That some deadlines have to be pushed. Create a strategy where everyone succeeds, and it's being part of that flexibility. And supporting the wellness of your employer is really important because you might not know if they're having some mental distress right now. And and this is all uncertain to us. So I mean, it's scary, but I know that we will overcome it. And so I think that all of those things are really important, but they come from a culture of trust. And so hopefully employers already had those things prior to have an awesome team that you're trusting, that they're at home and they're doing their job, and that you've given them that autonomy prior to them leaving home, and that that you have that supervisor support, work for success kind of like relationship with them, that that they're doing this, and and that you had already had like a great work life fits, like that you were already that great employer, that you will understood that they had to go to like their children's recitals or whatnot, or that you had that mentality, and and that you provided those benefits for them. And so I think that they will reciprocate that in this chaos and whatnot. And I see it in my team. So I hope that, it's the same case with everyone. But usually the first things that I did talk about, like, establishing those guidelines are really, really important. Mm-hmm. And so if you didn't have control before, I mean, it's not going to change, unfortunately. It's going to, it's going to get worse. I'm sorry.
Okay, so kind of some stormy news. So,
Yeah.
just over communicate, and if you have questions, just go that extra mile, ask that question, and make sure that you're doing check-ins and that kind of thing. Perfect. So if a business was not prepared for employees to work remotely, let's say worst case scenario, you're not prepared, it was that last minute, city ordinance just came out, you cannot go, so what exactly do you do? How can they be held accountable, or will they be held accountable for any additional expenses to keep working?
Ouch.
Throwing a curveball at you. This is the
No,
worst case scenario.
no. I mean, yes, most definitely. So at this point, you should have provided them with, a laptop. I mean, a hotspot, like, the tools for them to work at home. You can't expect your employee that's, a salaried employee, a non-exempt employee that's probably making like really close to minimum, to have their own laptop or whatnot. If they have their own resources that they could use, awesome. But the employer should not count that against that if they don't have the tools. Now, but this is a two-way thing. I mean, you know, as an employer, I have my own laptop. I mean, I'd rather use my laptop than the company laptop. You know what I mean? Or am I that employee that's like, oh well, you didn't give me a laptop, so I'm not gonna work. But you have a laptop.
Right.
I mean, so there's that area, but no, employers can enforce employees to go out and buy their laptops and and tools and resources and expect them to work if they didn't have it prior to.
Mm-hmm.
So yes.
Okay, so they would be held accountable for any additional expenses if they asked the employee to purchase something. Or
The employee should provide those tools for them. Now, let's say let's say the employee says, okay, go ahead and that's why it's important to have a work home policy, because you provide some type of reimbursement or a stipend for employees to go and purchase the equipment that is needed for them.
Okay, so again, maybe whip out that dusty HR handbook you have from your company from the first day you got there, and take a look at the policies in place.
And
Okay.
and most companies don't have this policy, and so it's because it's new.
Oh wow.
I know. I mean, I assure you that most companies don't have a work home policy.
Okay, sounds good. Okay, so will employees in self-isolation due to expected exposure still be paid?
Okay, first I wanted to talk about the employees that are, if they're working from home, if you have salaried employees, those are your exempt employees that get, a salary, and those are expected to work the hours that they were working and whatnot. Now, the non-exempt employees, you have to track if they're working and whatnot. You can't expect them just because they're home that they're going to be working till 9 p.m.
Okay.
Okay, you have to pay them the hour. So if they're working till 9 p.m., then they obviously incurred overtime. So you have to pay them that overtime. I mean, it's not we're not in the land of the wild, wild west here. You can't, the rules still apply to everything on how we do everything in HR.
Okay, perfect.
Okay.
And
Wanting to clear that one.
okay, sounds good. And how can employees who do not have direct deposit still be paid? Like, what are the different options if you don't already have it set up? Because I know now is a little late to come forward and ask to have automatic payments put in. So if you don't already have it in place for direct deposit, what are your options?
Okay, on that one, I mean, that should have been taken care on during your onboarding. And so hopefully everyone has a deposit already. If they don't, I mean, if you could call your employer, and I'm pretty sure that employers are going to be writing checks out and sending them out, via mail. I mean, that's the other way. You could also, if you have a bank that you bank with, you could go ahead and set up like, the prepaid cards that could be mailed out to them. So you could load the cards to them, and if it's not deposited to their account, they could have that preload debit card that they get from a bank. So this case, TFCU is one of our sponsors. So for El Paso SHRM, so I mean, you could go to TFCU and they have that available for businesses. So I mean, and they're still open. So I would call them and say how can I have that preloaded card, for my employees, so I could send it out to them.
Okay.
On your other question, Desiree, of the self-isolation due to suspected exposed, if they're going to still be paid, that one, it really depends on where they fall, on the threshold. So about 500, but they are required to self-quarantine, for the 2 weeks and not expose others to it. So it would basically be, if you're above the threshold, what is your company doing to address that? Are they going to do paid sick leave? I know under the threshold for the families first, you would qualify for, that would be a qualifying factor for you to have that paid sick leave.
Okay, sounds good. Well, thank you so much, Art. We really appreciate you being here. Again, to everyone who's watching, we're with Art Gloria. He is with the El Paso Society for Human Resources. So if you have any further questions, can we have our viewers reach out to you?
Most definitely. They could go ahead and reach out to me. They could go ahead and send a message to the El Paso Society for Human Resource page, and the team will be answering that. So we'll be on top of that. And I'm happy to be in Desert and Desi's corner today, right?
I know today Desi's corner was a little bit busier than I had expected. It was a little bit more lively, but I guess that's all part of the action. Well, thank you so much, Art. We really appreciate it.
Thank you. Take care. Thank you.
You too. Bye-bye.